Welcome, everyone. It is time for our October Tobacco-Free Tuesdays webinar. We're very excited for this particular webinar. I know I am. I am Gina Roberts, the Regional Coordinator with the Tobacco Use Control Project. And you'll see on the panel a couple of hopefully familiar faces. We have Sarah and Nicole to join us again today. Sarah Burkhead is the Regional Coordinator for the Central Region, and Nicole Mann is the Regional Coordinator for the Eastern Region. Sarah will be helping us with technical issues throughout the whole webinar, and of course Nicole will be monitoring the Q&A chat and answering any questions or kind of facilitating the question portion of our webinar at the very end. So please use the chat, use the Q&A button. We love to hear from you. Even though, again, we're in webinar style, we want to hear from you and have all the questions that you want answered. So again, I said I'm very particularly excited about this webinar. We are partnering with the Eliminate Tobacco Use Control Initiative, and that's an initiative to engage and support colleges and universities in implementing tobacco-free campuses statewide. And this initiative strives to advance a tobacco-free culture through policy, prevention, and cessation services on academic campuses in Virginia. And our steering committee has been very active for the past 3 years in really trying to educate colleges and bring them on board to implement tobacco-free colleges. So I'm excited about our two speakers today. You know, if you've been to the webinars before, and we do have a lot of new college and universities coming today, so welcome to all of you, and I hope you continue to join us each month. But if you're familiar with our webinar, we do a what's the T question at each webinar just to kind of get a feel of what you already know about the subject. So Sarah is going to put up, and I think they're going to be individual questions. So here's the first question. Take a few minutes to answer, or just a second to answer. Guess the number of tobacco-free colleges and universities in the U.S. So pick one of those choices. Take just a couple of seconds. Okay, and then I believe, Sarah, are we going to show the answer to that particular question now or move on to the second question? Okay, so everybody chose 2,560 for the answer to that. And the answer to that was actually 38. I forget the, what was the answer, Sarah?
It was the 2,560. Yeah.
2,560.
Yep.
Thank you. Okay, now on to the second question. Guess the number of tobacco-free colleges in North Carolina. Okay, and the answer to that one, what do you think the answer to that one is? Okay, most people either put 10 or 107, and it's 63. I do know the answer to that. So 63 colleges in North Carolina are tobacco-free. And now for the final question, and this is the one I love. Guess the number of tobacco-free colleges in Virginia. We'll see what you think. Submit your answers. I can't wait to see what people think about this one. Okay, most people thought 6, and some thought 10, or maybe 32, and the answer is 6. So we have 6 in Virginia. A lot of work to do, and so you can see why we're having the webinar today. But again, thank you for answering those questions for us. And now I have the great pleasure of introducing our speakers today. I'm going to introduce one to begin with, and then after that, we'll introduce the other one. Dr. Bernard Femmler is professor and Gordon D. Ginder Endowed Chair in Cancer Research and Associate Director of Population Science at Virginia Commonwealth University's Massey Cancer Center. Dr. Femmler has authored more than 130 peer-reviewed publications in the area of cancer risk, obesity, and tobacco control. Dr. Femmler's work has continuously been supported by awards from the National Cancer Institute and several other institutes of the National Health Institute. Dr. Femmler is also the leading force behind the Eliminate Tobacco Use Initiative here in Virginia, along with Dr. Anderson at UVA. And I've got to share this story with Dr. Femmler. The first time I met him, Jane and I had gone to his office for a meeting, and he called us over there. He wanted to really talk about tobacco-free campuses and how we can start that work in Virginia. And he had just recently been to the Texas Eliminate Tobacco Use Conference and came away with some amazing thoughts on that, because they're doing some pretty good work in Texas, some amazing work actually. And I remember him saying to Jane and I as we were sitting there, if Texas can do this, Virginia can do this. So, and not only that, he said, Virginia needs to do this. So he has been, along with Dr. Anderson and some other great committee members, and I know many of you are on the call, Lindsay and Elizabeth, and several more. He's done some amazing work. So I'm really pleased, Dr. Femmler, that you're able to join us, and look forward to hearing your presentation.
Thank you, Gina. Thank you. Glad to be here.
I believe you're still on mute, Dr. Femmler.
Can you hear me okay? Yeah? Okay. Thank you so much, Gina. Glad to be here, and I'm looking forward to the hour that we have with you. Did you want me to go ahead and start? I'm sorry.
Yes, thank you. If you could start sharing your presentation and start, that would be wonderful.
Okay, great. Let's see. Can I just get a thumbs up to let me know that you can see it okay? All right, great. So thank you so much for inviting me to talk. I'm happy to, share some lessons learned over the process of sort of embarking on this journey of trying to get more colleges and campuses tobacco-free and smoke-free. So for my talk, I'll give you a little bit of a background on Virginia tobacco policies, talk a little bit about what the Eliminate Tobacco Virginia Consortium is, and then I'll talk a little bit about the VCU policy and kind of the evolution and evaluation that we did with the VCU policy. So you can see here in this slide, this just gives you a rundown of the different tobacco policies in Virginia and how they've evolved over time since 2004 to the present. And what I want to call your attention to for today's talk is really talking about the smoking ban that was put into place in state offices and vehicles in 2006 by the then Governor Kane, and then also the clarification of this executive order more recently. So if you don't know about Executive Order 41, this is really was a really great initiative put forward by then Governor Kane to ban smoking in offices occupied by the executive branch, agencies, and institutions, including institutions of higher education. And agency heads and including institutions of higher education may set appropriate guidelines for smoking outside on state-owned property. This was, a great move for smoke-free campuses and smoke-free state offices and buildings. And because of that, all the campuses in Virginia have gone smoke-free. No, I'm just kidding about that. Actually, if you've got the poll right, there's now 6 campuses in Virginia of higher education that are smoke-free. One of these is a medical school. So these were the first 4, and more recently, the next 2 have gone tobacco-free. And that means they're recognized by the American Non-Smokers Association Rights Foundation for being a smoke-free campus. And that's what's included in that 2,500 and some campuses across the nation that are smoke-free or 100% smoke-free. So you have to have a certain level of criteria in your policy to meet that definition. So at any rate, so why didn't all those campuses go smoke-free in 2006? Well, there was a little bit of a clarification set by the then Secretary of Health on some guidance. So the state institutions asked for some guidance on this executive order. And basically the guidance said that smoking is permitted outdoors on state property grounds and similar open pedestrian ways, provided smokers are 25 feet or more from a distance from an entrance or exit, and the owner of the property should include ash urns outside locations. Well, you know, this was, I don't know how this got into place, but this was really what all the colleges then went in and designed their policies in accordance to these guidelines. But nowhere in Executive 41 did it say anything about this 25-foot rule. So that was a very confusing time, I think, in terms of, you know, the ways in which the tobacco-free policies kind of got curtailed a little bit in ways that were really not intended, I don't believe. So about 2018, maybe a little earlier, I sat down with Gina and others and Jane and talked to them about, you know, this idea of how do we get started here in Virginia on tobacco-free campuses. And we had a lot of planning over the years, and we started the Virginia Tobacco Higher Education Summit in 2019. We had a number of people that attended that summit. It was a great, well-attended. People were really jazzed about the idea of learning more about how they can alter their policies so that it's tobacco-free and smoke-free. Then more recently, we've partnered with the MD Anderson Group, Eliminate Tobacco Virginia Initiative. And then, so now we are a consortium called the Eliminate Tobacco Use Virginia. And this consortium aims to bring together tobacco control and college health champions from higher education, share information about tobacco control education, cessation, services, and research, and share resources and best practices for improving campus-wide tobacco control efforts and policies, and developing strategies to improve tobacco control and implementation of these policies in higher education in Virginia. So we are a very cohesive group. We meet on Fridays about once every month. And so one of the things that we did was that we asked the VDH and the governor's office for clarification on this Executive Order 41. And we asked probably right after our conference in 2019, and we waited a long time to try to get anything, any kind of clarification on that. We were confused. The Executive Order 41 says one thing, the guidance says another. It's very inconsistent. But more recently, in an effort spearheaded by Andrew Romero and John Fritz at Virginia Tech, we sent a letter from our steering committee to the Secretary of Health and Human Resources, Dan Carey, for clarification on this order. We said that, you know, Virginia is significantly behind other states, and we believe that the reason why they're significantly behind is because there's this inconsistency between the executive order and the guidance document that came out after it. And so finally, in June of 2016, we received clarification on the executive order and from Secretary Dan Carey's office, and it says, in our review, we've confirmed that Executive Order 41 and the related guidance documents do not prohibit institutions of higher education from banning smoking in all spaces deemed appropriate by the institution. So we encourage you to review your current policies and consider opportunities to strengthen them. wow, that was a great news. We all celebrated. You could hear the champagne, popping and everything else. And so so now the gates are open, and we are ready to move forward with tobacco-free campuses here in Virginia. There should be no excuse now that we have to pay attention to some executive order and guidance document. It is clear now that campuses can make these changes. While this was going on, Virginia reviewed their policies right around 2018, 2019. At the time, VCU had a tobacco-free campus on the MCV campus and the health campus. But then on the main campus, the Monroe campus, there were designated smoking areas, and they had the rule of like you can't smoke within 25 foot of an entrance. So we worked with our campus during this time to initiate some changes to the policy to strengthen them in support of tobacco-free campus. So we wrote for a small grant from the American Cancer Society, and we had this grant supported our efforts to meet and to evaluate our efforts for changing some of the policies. In order to evaluate and really kind of understand what the climate of the campus was at the time before the ban, we did some surveys, focus groups, and interviews with students and staff. Then after the ban went into place, we weren't anticipating that the ban was going to take place, but it did. We had the support of the campus and the higher, the executive office, Rouse office, and others to make this happen. So with our environmental scan, what we noticed when we sent out some undergraduates all over the campus, and they scanned every square inch of the campus, they found a lot of inconsistency in signages. Even though we have this 25-foot policy, signs were not really consistent with that. So there was a lot of miscommunication about what the policy is on the campus. The same thing, you would think with the medical campus, there would be more clear there because it had been tobacco-free since 2010. But even there were inconsistent signage across the campus. They also found a lot of these hot spots where there were a lot of cigarette trash, and interestingly enough, they were not near these designated areas on the campus that were for smoking. They were just sort of all over and in places where there were large numbers of students that gathered. With the help of the Brand Center at VCU, we did some man on the street interviews to kind of learn more about what students thought about a policy for a tobacco-free campus. We also did focus groups with students, smokers and non-smokers. And so the gist of this is that, many people were telling us that, there are locations where smoking happens on campus, that, tobacco use is sort of a personal choice. And that if you are going to make policies, you really, should think about, not being punitive, trying to be more supportive. But overall, there was this consensus that it's okay for campuses to focus on clean air policies. So in 2019, July of 2019, VCU initiated a new policy which banned smoking on all grounds, and there was a little bit of a carve out. There was a carve out for certain designated areas, minimal number of designated areas, and that was because we didn't have that clarification of Executive Order 41. Our folks that developed the policies for VCU said to us, we want to strengthen our policies, but the guidance says we have to have some places for people to smoke. And so they were going by the guidance. So luckily now we don't have that guidance. And so I'm trying to work with our campus to sort of do away with those designated areas. And we'll see what happens. But last time I talked to them, they said, well, what are the other campuses going to do? So we're looking towards you to help us here at VCU to get our campus completely tobacco free and on that list of the American Non-Smoking Rights Foundation. So let me just share quickly with you the results of our evaluation. After the ban, we found that many people were in support of the changing the ban. So they were, after the ban, there were a higher percentage of students that were in support of a full ban. Also, faculty were in support of a full ban. Students were also in support of a full ban for e-cigarette use, same with faculty. So that increased favorability and attitudes towards tobacco-free campus also changed. The students were more favorable after the ban went into effect, and as were faculty. And interestingly enough, when we asked them, how many times they smell or see smoke on the campus, the percentage of people who said sometimes, often, always decreased after the ban. So it seemed to be that there were less people at least reporting seeing smoke and smelling smoke on campus. We did see slight percentage differences in the percent of people who were smoking. So current cigarette use percent declined after the ban, as did some of the other tobacco products. Interestingly, the sort of dual use, the e-cig and to combustible tobacco smokers, also there was fewer people reporting past 30-day use and fewer people reporting past current cigarette use after the ban. Students also, we didn't see that we were able to, the students weren't really being advised to quit or anything like that, but more people indicated that they knew that there were resources on the campus for smoking cessation. So if you want to read more about some of this work, you can see it in the published papers that we have on this, on the evaluation, the survey before, and then the evaluation for the pre-test, post-test of the ban. I would like to thank the American Cancer Society, obviously, for their grant for the Tobacco-Free Generation Campus Initiative. The Office of the President at VCU also supported our efforts. They gave us some support for research assistant to help with some of the surveys, environmental scans, and such. And then we worked closely with at the Student Wellness Center. And of course, my collaborators, Elizabeth Doe was a tremendous collaborator with me on this. Now she's at the Truth Initiative, also Wesley, Kendall, both now graduate students, one at UVA, one at VCU, and many other students and research assistants in the Brand Center. So thank you for your attention. I'm happy to answer questions after.
Thank you, Dr. Thumler. I think your presentation really challenges everyone to look at their college campus, their university campus, and see what we can do as a community, even if we're not on a college campus, and also definitely if we are. So thank you very much. We will take questions at the very end. So please type them in the question and answer box, and Nicole will facilitate that at the end. And now I have the pleasure to introduce Dr. Grant Asdale. And Dr. Asdale currently serves as the Vice President for Student Affairs and Dean of Students, and is a professor at Randolph-Macon College in Ashland, Virginia. As a Senior Student Affairs Officer, he serves as a member of the President's Cabinet. Dr. Asdale has provided almost 30 years of leadership in the areas of assessment, strategic planning, budgeting, retention, fundraising, and higher education law. And, as I finish my introduction, I do want to kind of draw you back to one of our what's the T questions. How many schools in Virginia are now tobacco free? And also Dr. Thumler's presentation, because Randolph-Macon was one of the 6. Whatever you're doing, whatever Asdale was instrumental in actually putting this policy in place. So whatever you're doing, it works, and I hope you can kind of share that with everyone. Thank you for joining us, and I will turn this over to you now.
Thank you, Gina. Thank you. And thank you for everybody who's joined us today. I will say that at the start of our project on our campus, I had a full head of hair. So something happened as we went through the process, but the results were very good. And my colleague from VCU has a very different campus than we do. We're more more suburban, he's more urban. So my hat's off to you in your challenges, because most of your campus is on the city streets of Richmond, which means you're trying to control for a population that is not yours. And all of us on the college campuses have trouble controlling our own populations, let alone an urban population like that. So again, hats off to you for what you have done in that area. So I'm going to start sharing my screen. In a little word here, the information I'm told will be available to you at the end of the webinar. So don't worry about keeping up with my PowerPoint slides here. And we will be able to at least jump through this pretty quickly. And you're going to see some similarities. I'm going to jump through some of our slides because it's very similar to what was just shared about the VCU campus as far as history. But we actually had a little bit of a different viewpoint on this. Pre-COVID 2019, if you remember back, we were dealing with still are, a huge uptick in vaping illnesses and deaths. And there was a lot of media about it, which was both unfortunate and serendipitous at the same time. We didn't have to just build on the known health hazard of smoking and the addictive properties of nicotine. We were also dealing with waste and litter issues, as you'll see in just a moment. We took a multi-pronged approach towards trying to do this, but talk about striking while the iron was hot. We had this movement at the same time with the vaping illnesses. So we included all forms of vaping in what we were doing as a result of that. We had some of these things about and you'll recognize this from some of the VCU pieces as well. We took our lead from other schools that were already smoke-free and looked at some of the things that they looked at. We have a mostly residential campus and we are suburban. So we have a little bit more control, even though we have town streets in Ashland that run through our campus. We do have a little bit more control over the campus as a whole, and our folks who work in our physical plant who would do a lot of the cleaning were able to actually do some of the similar studies that Bernard mentioned with regards to counting cigarette butts in different areas. You cannot minimize that research. It's really important to know where your hotspots are. Other pieces here, we knew that many campuses had banned smoking. We knew that the 25-foot rule became common on many campuses. We had the same situation that Bernard mentioned at VCU. Signage that mostly said smoking within 25 feet of the building was prohibited. Most people ignored it. Many of our faculty members were the biggest issue for us, as well as some of our staff members as well, not students as much, because the student conduct code covered that issue. Some of the other pieces we did similar situations to VCU: surveys, student government involvement, faculty senate governing body, staff advisory group. We used our own health professionals. At the time, another piece that was really key is our Randolph-Macon nursing BSN program was getting off the ground. So that was another emphasis. We knew that building was going to be smoke-free from part of a health perspective. Our other health facilities were already smoke-free, counseling, health center. And now we have a PA program coming on board into a smoke-free campus, which is a very big change since 2019 and a welcome change for those PAs as they come forward. But we looked for facts and we looked for data to try to drive our decision-making. We knew this was in place. We knew that at the time, more than 2,400 colleges and universities had banned smoking, vaping. Did a lot of research on organizations out there and what was required to be known as a smoke-free campus nationally. And the ANRF is indicated there. If you don't know that group, go ahead and get on their website and see what that's about. We had to jump through quite a few hoops after our ban and make some adjustments to our policy to be recognized as a smoke-free campus. We did see an uptick in some of our enrollment as a result of our smoke-free policy. So there's another benefit to doing what we did. We had some students who were actually looking not for just wellness buildings, but looking for smoke-free environments as a whole on the entire campus. This is some of the things that we shared with students, pictures from around our campus of just the waste. We get so blind to it. We see it everywhere, so we don't pay attention to it. But I would tell students, stop in your car in a turn lane at any traffic light anywhere in Virginia, and you will see this kind of litter. all along the street. And smokers don't think about discarding their cigarettes and how long the filters stay there. And so we did some of this research, and from an environmental standpoint, talked to our students about this. We also have a lot of brick pavers on our campus, and we took pictures of the brick pavers with cigarettes stuck down into the brick pavers, so students could see how much of that was in place. But this one actually got the most response. Birds nesting on the campus with cigarette butts used as part of their nests. So some of our students were really shocked by this, but you shouldn't be shocked by this. Birds are going to pick up whatever they can to make their nests. We wanted to emphasize that this is a larger problem than just health. It's an environmental problem for us as a whole. You wouldn't throw bottles and cans out of your car on the side of the road. At least most human beings would not, some would. And we made the same emphasis on cigarette butts. Is no different than any other kind of litter, yet it is so acceptable to step on a cigarette outside before you walk in. These sorts of things were pretty common. So we actually tried to make sure that we structured this, and this is a how-to for the campuses out there that are doing it. The decision ultimately has to come from your senior administrators, and there has to be unanimous support for change. Your faculty has to obviously be on board, but I think there's no difference between private and public schools in this matter, as you are allowed to designate rules for your campus. The fact that as Bernard mentioned, the fact that more of this didn't happen as a result of some of the state changes in policy is quite amazing to us. And you could see, we mentioned North Carolina in this too. I used to live in Raleigh. North Carolina and Virginia are big tobacco states. Many of the schools in North Carolina were built with tobacco money. So that's not lost on us. But even the tobacco companies, at least in their public facing side, are part of the effort to try to get smoking to stop. If it's not, it may not be in their fiscal side, but it definitely is in their PR side. So you may even be able to get some support from some of the tobacco companies to try to stop smoking on your campus. Who knows? Obviously, state schools, a little caveat there, need to clear that with your governing agency and your college council of how you do it. Expect two different kinds of responses, as we did. We had many people said it's about time. We had other people who were really upset. Smokers' rights, this is my right, and you're infringing on my right. So expect those two responses when you start talking about this, not when it's passed, but when you start talking about it. We already had people coming out of the woodwork who could see the writing on the wall, so to speak. Once the decision was made, which we did, we gave significant lead time. We gave about 2 months, again, still pre-COVID. We gave about 2 months for the policy to go into effect. We didn't debate it anymore once the decision was made. We didn't have any more sessions. We didn't have any more conversations about how to share the research and that sort of thing. We just said, this is what we're going to do. We had the support data available in case people wrote to us individually, and they did. I directed all complaints to my office so that we had one voice to be able to respond with it. We also had our PR and marketing office involved, and they had 0 inquiries. All the inquiries came to me, most of them from people who smoked and wanted to know, well, what am I going to do? I don't have time between my classes to go smoke, and you're making me go, off campus to smoke. That kind of response was what happened. We also did release information to the news media, and there is a link there that will be available in the PDFs that are sent to you that you can look at, but that story is still up. You can see how it played in the story. One quick note about that. They interviewed about 15 students on campus before they found one who said, I think it's unfair that we do this to our residential students. And then they cut off the second part of his interview because we saw the unedited footage before it went out. He said, I think it's wrong, but it's going to make the campus much more healthy. So he even had a positive piece on the end of his comment, but they wanted opposing views. So they interviewed 15 students to find one guy that thought it was not okay for infringing on the rights of smokers, even though he himself was not a smoker. So interesting little feedback there about your news coverage, which I'm not saying it's biased, but I'm saying they were trying to balance it out, and they had a hard time finding someone who was opposed to our smoking ban. We also went ahead and did this double-pronged approach in helping people quit. We used Keith Cartwright is our AOD specialist. He actually works also with the Virginia Department of Health. He's a fantastic resource on our campus. He helped tie us into many programs that are available to help people stop smoking. We also approached our health consortium with Anthem Blue Cross Blue Shield to see if they would be helpful. They were helpful with providing smoking cessation program information. But just so you know, we asked, can we get a discount on our healthcare coverage if we go smoke free? And the answer was no. So we tried, but you can try as well. But we did get them to help us with cessation programs. So we didn't just say to people, you can't smoke. We took this opportunity to say, hey, if you've ever wanted to quit and this is annoying to you, then why don't we talk about ways to quit? And as I'm saying this, I'm really talking about being nicotine free, because we banned, this is one of our revisions, we banned smoking, vaping, nicotine use on any college property, including our equestrian farm that's 3 miles from our campus, about 70 acres out there. We banned it out at the farm as well. So you're not allowed to use it on any of our college properties. So this is our policy that we use. Feel free to steal it. We tweaked it a little after the fact, but we did put this policy out on our website. It's available out there. We did a blast to our town of Ashland. For those of you who don't know where we are, we're 15 miles north of Richmond, right off of I-95, but we have a town that takes full advantage of our grounds. So we had to make sure that folks in the town knew that we were smoke-free, vape-free, and we made this as clear as possible. Without putting up a ton of signage in our public spots, we were able to get the word out on campus, which was helpful. We also had this on our side. The timeline is November. We did our policy, and December 20th, federal legislation was passed to raise the age of smoking and vaping to 21. So again, serendipitously, a great boost to us, as most of our students are under 21, except for some juniors and seniors. And that actually affirmed our work on campus. And since we already had our policy in place, it just assisted us with our policy. Signage, we already covered this. Bernard covered some of this. We had similar signage on campus. We had to pull down the 25-foot signage and put these kinds of signs up in place that included, vaping, electronic smoke devices of any kind, or tobacco products. So we updated our faculty and staff handbooks and our student code of conduct to match our policy, so that there were workforce enforcement in the policies, and also so that the code of conduct matched what we were saying now. And we had to actually clean up the code of conduct. We found multiple references to the 25-foot rule that all had to come out. We had an informal advisement period in place. So everybody talked about, well, how are you going to enforce this? How are you going to enforce this? So we took 2 months to basically use our paraprofessionals in student life, our student life professionals, our campus safety professionals, and just to remind people as we saw them on campus using products to actually that they weren't permitted to do so. Again, we had town streets that are running through our campus. So technically a person can walk within 6 feet of the street and smoke a cigarette and still be within our campus barrier, but they're not on campus. So that was allowed. So what we saw immediately, right? We did the smoke, the assessment of cigarette butts on our campus. Immediately, we saw more cigarette butts along the town streets, to be expected. But it gave us a chance to be able to clean those very regularly and get that waste material up. And we started publicizing on the campus the waste material counts, how many we were finding on the city streets, and a reminder that just because we don't allow smoking on our campus does not mean you can litter on the town streets. And we actually saw a vast reduction in the number of cigarette butts that were on the streets. We also removed all those smokers outposts. You all have seen those plastic smokers outposts on campus. We removed all of them. And smokers wanted us to put them along the town streets where they were smoking. We refrained from doing that. We just refused to do it. We've got a bunch of those smokers outposts still in our physical plant lot that are not in use. But we just decided we weren't going to provide locations for people to smoke, trying to make it more difficult, but also trying to work on the cigarette butt waste. If it's, I can't say it a better way, shame people into not throwing their cigarette butts onto the road. We have a resident here local that's a retired person who all he does is go around with a bag and pick up cigarette butts. And he tells us where he found them and he counts them. So we still have a bit of a problem, but it's far less than what it was along the town streets. So we had that 2-month piece without consequences. Honestly, I think we had 1 or 2 conduct cases come up where a fine was issued to a student who just refused to go to a spot where they could smoke legally. But that stopped. And as we've moved through now from 2019 and through the COVID times and that sort of thing, now there are fewer people actually smoking for some of these other health reasons, and they appreciate the fact that we have the policy in place. This is another piece, is you're going to have visitors on your campus. I can only imagine what VCU is like with this, as I mentioned at the outset, but we've got some control over this, and we're able to kindly say to people who are visiting our campus that we are a smoke-free campus and that they cannot smoke on our campus. Believe it or not, that third bullet, special considerations for sporting events, cigarette smoking is not allowed based upon NCAA standards in any stadium, but guess what's not covered? Tailgating areas. So tailgating areas was a special consideration. We actually had folks who were securing tailgating spaces early on acknowledged our no smoking policy and agree to follow it if they were on our property in these spots, in these tailgating spots. And we got some grumbling very early on, especially from some of my alumni who smoke cigars. And apparently that's a thing with the tailgating. That stopped. We just kindly went around and said, hey, we have a smoking ban in place. It's for the students. Please don't smoke. People were pretty gracious typically and didn't smoke in the tailgating area because they just didn't want to get hassled. And if somebody kept doing it, we were prepared to tell them, look, we're going to sell your tailgating space to somebody else who will obey the rules. But we did not have to go to that point. So I think it's also helpful to track these numbers even after the program is put in place. Research data really works, especially in an educational setting. My faculty were wanting to stand up for my faculty colleagues who smoked. When we did our early surveys, it was the faculty who were against a smoking ban. Believe it or not, the students were not. There was a couple percentage points, but not like it was with the faculty. So it actually, faculty, staff, students in that order as far as being opposed to the policy. But it was still a majority of people, a vast majority of people on our campus who were okay with the policy. So we kept doing these pieces with smoking cessation programs, education programs, counting cigarette butts on the town streets to try to tweak the program as we went along. And we were actually pretty successful in keeping that at the forefront for our community. So I'm going to stop sharing my screen. I'm going to turn it back over to our coordinators and hopefully we'll get some of these questions answered. But I hope that was informative to you. My one piece of advice to campuses that are looking to do this is ask for help. My email will be available to you and shareable, I hope, and I'm happy to help you step through some of the processes and also avoid some of the pitfalls that we ran into during our process. And I thank you for your time.
Great. Thank you, Dr. Asdale. A couple of things you mentioned that struck me is your enrollment slightly increased. So that says that people are looking for those tobacco-free, smoke-free campuses to go to. So I love that. And pictures make all the difference. I mean, to see the litter all across your campus and then to see the bird's nest, I think it really kind of opens people's eyes to that. So great job. And I really applaud you. And thank you so much for coming.
Yeah, and
today.
Gina, one more piece I failed to mention, but we see this all the time. Everybody thinks everybody's a smoker because where are they gathered? Out in front of buildings. And everybody thinks that everybody is smoking. And the case was we showed that very few folks on our campus were smoking. And we were also able to show the waste out in front of those buildings. Nobody wants to go through a cloud of smoke coming and going from a building, and the 25-foot rule really was not working for us.
Exactly. Great job. Wonderful job. So I'm going to turn it over to Nicole now. I know a lot of questions came in through the chat, so we can start that. I'll turn it over to you, Nicole.
Hi, everyone. Dr. Femler, Dr. Asdell, thank you so much for your presentations. I loved your GIFs, your pictures, all the comic relief in them. It seems like our audience did also. We have maybe about 5 minutes for questions, and we got a bunch. So I'm going to try to summarize them. And if we don't get to your question, feel free to reach out to one of us as well. So one of the multiple questions we received was about terminology. So we talk about smoke-free, tobacco-free, vape-free, nicotine-free, and also with cannabis kind of coming to Virginia. How would you guys prefer, or what I guess is the ideal way to present this policy? Is it tobacco-free? Is it nicotine? What is, I guess, the overall term? And then what would ideally best practice be included in that policy as well?
Well, I would encourage people to look to the American Non-Smoking Rights Foundation. And then, of course, Dell's policy is in line with that. But the main thing is you want your campus to be tobacco-free and smoke-free, and that includes vaping. And so those provisions, those explicitly saying those things helps to strengthen that policy.
Yeah, I would agree. We use the policy language the same and included all those things. It made it a little cumbersome in its presentation, but you just include all of them. And a piece about cannabis use, even though cannabis use is tolerated, quote, legal in Virginia, the federal law still prohibits it. Drug-Free Schools Act still prohibits it on college campuses. So. And it's a form often of smoking. So if you ban smoking, you're banning smoking of marijuana as well. But the Drug-Free Schools Act also still gives us the ability to enforce marijuana use on our campus as well.
And really quick to build off of that terminology, I know some products claim to be nicotine-free or I guess synthetic nicotine. Would those nicotine-free products also be part of your policy as well?
I think, yeah, that's the goal, is to, try to, ban nicotine, tobacco, smoke, marijuana, make it clear that, this is your campus is free from these products.
I think the health risk too of these so-called synthetic nicotine products and vaping products, I think that's pretty well documented. So I would advise people to use the research.
Great, thank you. One of the questions we received before the webinar during registration is, how do you recommend starting this process? Tobacco-free campuses, particularly without a budget for this work. And I do want to first link that Truth Initiative does have a grant for that. And I will put the link in the chat real quick for people. There is an informational webinar today, actually, at 3 p.m. Eastern Time, and also November 4th. So you can look for information on that. And the deadline to apply for this grant is in January 20th. So I'll put that link in. If you guys have any, Dr. Femler, Dr. Asdell, if you have any big points you want to talk about, feel free to, and I'll move on to the next question after.
I think if people are going to apply for those grants, yeah, just reach out to myself. And I forgot to also call out Lindsay Hauser, who's at UVA, who's been a great force in this in our ETU Virginia group. So reach out to us. We're happy to share our application that we had for VCU for the ACS with anybody who's interested. Just kind of see what it was about. But it's not a lot of money, but it shows that there's an interest, and that gets the attention of your administration. So if you can get somebody to write one of these, it shows that there's an interest, and then people start paying attention.
I just would say, Nicole, I spent $0 up until the time the policy was implemented and I had to change signage. That's where the cost came in. But I used faculty, staff, and students and my health team on campus as free labor. So all of our research was done behind the scenes and for no dollars. So we did not seek a grant. I wish I had for the signage changes. It was more expensive than I thought it would be. So do prepare yourself for that.
Yeah, and I would just add to that, we didn't really spend that much money either, actually. We had, I think our most thing was like going out and sending those students to do all the, but we could have got the volunteers. But I think you're right, Grant. If you don't need a lot of money, you need the money for the signage, and then sometimes getting rid of those ash urns and replacing them with other things. Can be, there can be a cost there. And also, if you're going to provide educational materials about the new policy, or else those kinds of buttons and things like that can be helpful in getting the word out.
Great, thank you for that. I was kind of wondering what would your most expensive cost would be. And then for technical assistance, if anyone has questions, you can reach out to one of us, the Eliminate Tobacco Use Summit team. We can also help you. I know Andrew Romero is helping a lot with George Mason. Public Health Law Center can help a lot with the policy writing for legal reasons as well. So there's a lot of free resources out there. And you can also reach out to us if we can't help you. I'm sure we'll try to find someone who can. I think we're all, our end goal is tobacco-free campuses in Virginia. So all of us are working together to the same goal, and we're happy to collab with anyone. And we are getting short on time. So let me find one more question. Let's see, anything that was really big. And okay, Dr. Asdell, someone did ask, what was your response to students who use tobacco and were concerned about the policy? I know in your presentation you talked about all of the questions came to your office. Was there a general response for people? What was, I guess, the most asked question or concern students or faculty had?
I actually had more concern from incoming parents of my freshmen after the policy was enacted, because they knew their students were vaping most often and were afraid they would get in trouble. So I did a lot of education with those parents during the summer between their students' high school and their students' college experience. And I worked with those students and encouraged them to have them come to me and talk about the research. Really treated it like an educational opportunity with those students. Most of the students were shocked that their parents had outed them, but we're a very warm and inviting campus, and we're able to have those one-on-one conversations, which I think were very successful. My current students, and I'm not joking about this, I think I had 2 complaints from smokers, and they were smokers who literally the first thing they do as they left their class was light up, or that when they left their dorm, they'd light up. And so they actually adapted quickly. They were smoking on the town streets and walking the sidewalks on their way to those areas. And it became a pain for them. And some of them actually took us up on the smoking cessation program. So I did not get the kind of attacks that I thought I would get. I had one very adamant faculty member who swore I was stepping on his legal rights. And, this is an advantage. We're private property. We're not public property. So we're able to enforce this from the point of view that it is private property. And if you want to smoke, you go onto public property. I'll say one more thing. I don't know if this is a weird distribution or not, but some of my campus safety officers were smokers. And I had a 2/3 turnover in my campus safety over the last 2 years to non-smokers. So it's been interesting, but some of my campus safety officers, because I would get on them, they're setting the example for faculty, staff, and students. I would get on them if I saw them smoking in uniform. And some of them went on to do other things. And we've got far, far less smokers in that area now. And as a transition, I was prepared for.
Thank you, Dr. Azza. Thank you for pointing out that your concern was for parents. And now that we know that all public primary and secondary schools in Virginia are now tobacco-free, I think that transition would be a lot more smooth now into colleges. So I'm going to send this off to Gina to kind of close us off, and we'll get some more interest. Thank you so much, guys.
Thank you, Nicole. This has been a great session, and I think it's really kind of moving Virginia to that next step. So all of you on this webinar can really kind of think about how you can help, how you can join this. We do thank the Eliminate Tobacco Use Virginia initiative for hosting this webinar, and I can't say enough about the initiative. And if anyone wants to be involved in that, I think Lindsay put her email up in the chat. And it's really so that we can all become engaged in this collaborative effort throughout Virginia and put our numbers up there higher than North Carolina and really kind of strive to make that the goal for Virginia. Now we have one last, we love the what's the tea question. We have one last what's the tea question. How confident are you that Virginia can surpass North Carolina's number of tobacco-free colleges and universities by the year 2023? So we're giving it a little time, okay? Never gonna happen. We had to put that one up there. Maybe, sure, we'll see an increase. Yes, we'll get close to North Carolina, or definitely let's go Virginia. So go ahead and put your answer in there. Give you a couple seconds to submit, and we'll see what everyone put up there. I want to see never going to happen. I want to see how many of those we have up here. No, never going to happen. I love that. So we have 48% definitely let's go. And then the next one was maybe 31%. So I think that's pretty good.
Our audience is biased.
Exactly. I know. So, okay, with that, and we have this webinar so you all can participate and really make this happen in Virginia. So after this webinar, you're going to be receiving, we wanted this information to motivate you and help us move into action. So we're going to have a poll or a Google Doc, and I think, Sarah, if I'm correct, this is going to come with the follow-up for you to fill out to share any university and college contacts that you have, or to see if you want to become involved, because you may not be on a college campus, but you very well may have some support on a coalition from a college or university, or you may be involved in some activity on a college campus. So we want you to be involved and to fill out the Google poll when it comes to you with the follow-up. But here it is. Sarah already put it in the chat, so you can fill it out now, or you can wait for the follow-up. Please fill it out because we want to be calling you. We want to get you on board to do the Eliminate Tobacco Use Initiative here in Virginia and really get going with this. So thank you all. I know that we have a lot of colleges and universities on the webinar. Please continue to join us. We have our Tobacco-Free Tuesdays on the third Tuesday of every month, and we have topics just like this. Our next Tobacco-Free Tuesday will be November the 16th from 10 until 11. And kind of in recognition of the Great American Smokeout that's coming up in November, we will hear from a panel of former tobacco users who share their journey, their quit journey. So how did they quit? What cessation tools did they use? How did they do it? And I think whether you're a healthcare provider, whether you're at a college, you need to know everybody's personal journey and how you can kind of fit in with that. So again, I want to see all of you back here next November, or this next Tobacco-Free Tuesdays in November. Until then, thank you again for the speakers, Dr. Asdale, Dr. Femler. Thank you, gave great presentations. And just all of you, until we meet again, just enjoy these beautiful days that we're having this fall. Thank you so much.
Thank you.
Bye.